Hello, this is Joshua Tucker with Tendonitis Expert. So right here we're going to talk about some wrist tendonitis basics. And let's start with, do you have wrist tendonitis? So an easy way to identify that is just where you hurt and how you hurt. With wrist tendonitis, you can hurt right here, and or right here, and or you can have tightness, pain, etc. right here. You can also have pain around your elbow. So the diagnosis isn't particularly important because unless you have a broken bone or a fracture or a torn ligament, then you have a soft tissue problem, meaning these muscles are too tight and they're pulling on these tendons. Tendons attached to the wrist, tendons attached to the fingers. So mostly when we have quote-unquote wrist tendonitis, even with the diagnosis from the doctor, all the attention is on where the pain is. But realistically, that's not the cause of the problem. So if you do have wrist tendonitis and you do have pain and or tightness in your wrist and forearms, then you want to get rid of it. Obviously, that's why you're here. So how are we going to do that? To do that, we have to find out, or we have to ask the important question, which is not where does it hurt, but why does it hurt? And wrist tendonitis hurts for three primary reasons. The first is that your muscle connective tissue is too tight. So even if you have pain right here, it hurts because all these muscles are too tight. They're pulling on their tendons and they're compressing the wrist joint. They're compressing all this tissue. That's one of the factors. Things are too tight. The second is chronic inflammation process. So when things are tight for too long, they're pulling on all their connections, and that causes irritation. And that sends a signal to the brain, which says, there's pain, there's a problem. So what does it do? It kicks in inflammation process. And one of the main factors of inflammation process is that it releases chemical which enhances your sensitivity to pain. So now, all through here, you have this little chemical floating through, and it's in your tissue, and it's putting your nerve receptors on edge. So any little thing can hurt, including all the tightness that's constantly pulling. Constant tug-of-war with irritation and pain created. And a lot of that pain specifically is from the pain-enhancing chemical. The third main factor is nutritional insufficiency, meaning your structures don't have enough nutrition to work correctly. So for instance with your muscles, it takes calcium to fire a muscle and magnesium to stop firing a muscle. So your muscles literally get stuck tight. They should be this long, kind of in a relaxed state, but when they're tight and can't relax, they're at this length constantly. So your muscles are too tight. They can't relax because they don't have the right nutrition. Additionally, inflammation eats vitamin B6. So then you don't have enough vitamin B6. And lack of vitamin B6 can cause various symptoms, including pain and carpal tunnel symptoms. So then we start looking at why the treatments you've tried so far don't work, like rest and corticosteroid injections and anti-inflammatories and strengthening and stretching exercises. Why haven't they worked? Well, they haven't worked because if you don't deal with all three of these factors, then you're not going to get, quote-unquote, a fix. Anti-inflammatories, at best, only deal with the inflammation process, but they don't deal with the cause of the inflammation process. So anti-inflammatories are fine to get you through the day, but they're not a fix. And rest doesn't beneficially help any of these. And corticosteroid injections, kind of like this, they might help a little bit, but they don't address the cause of the problem, which is not enough nutrition, something that causes the inflammation process as well as the inflammation process, and just structurally things are too tight and stuck too tight. So if you want to fix your wrist tendonitis, you have to deal with all those. Because while this is kind of a dramatic picture and it looks like a big mess, it's really not that dramatic, and it really is as simple as reversing these three factors. So that's what you need to do.